In the previous video, we completed disturbances in the development, that is nothing but the developmental abnormalities. Now, in this video, we will be discussing the hemodynamic rearrangements. Within that broad topic, we will be taking the hyperemia and congestion. Now, to make it simple, in this video, we will be discussing only the topic, the concept related with hyperemia, and in the next upcoming video, we will come with the congestion. Now, let us look at the word hyperemia. Hyperemia include the two words, that is hyper and emia. As you all know, hyper is anything which is above the normal, and emia, as always, it indicates the blood. Hyperemia is nothing but the increased volume of blood in affected tissue or any other part of the organ of the body. Now, generally, the hyperemia is itself classified as acute and passive. The active hyperemia is itself is called as hyperemia, and the passive hyperemia is called as congestion. There is exact differentiation between the hyperemia and congestion is there. Let us understand that lies in the cause of the increased volume of blood in the affected tissue or the part. Let us consider. The first one is active hyperemia. When there is increased blood volume in the affected tissue is because of the increased blood flow in the capillaries or arteries. In such condition, we will be referring that as hyperemia. And the second condition is congestion, that is nothing but the passive hyperemia. Whenever there is the condition where impaired venous drainage will be there, or the vein is unable to carry the proper blood within the vein, that may be because of the impaired vein walls, that will be leading to the blood accumulation in the vein itself, and that is nothing but the increased volume of blood in the affected tissue or the part. In such condition, we refer it as the congestion. I hope the concept is clear. Hyperemia is because of the increased blood flow in the arteries and capillaries, but in case of congestion, there is the walls which are present in the vein, they are unable to function properly, or there is any blockage in the veins will be there. In such condition, the passage of the blood will be impaired by the blockage of the veins or any dearrangement or malfunction of the walls of the vein, leading to the accumulation of the blood in the vein. That will lead to the stages of the blood in the veins, ultimately leading to the increased volume of blood in the affected tissue or the part, and such condition is called as congestion. Now, let us classify the hyperemia. Hyperemia is classified as active and passive. Active, generally it is called as hyperemia itself, and passive is called as congestion. Active hyperemia is again classified as general and local. In case of general, the hyperemia is occur throughout or whole the body, and in case of local, it is restricted to the regional part of the body. For example, in the digestive system or in the lower extremities of the legs. In such condition, we refer it as local hyperemia. And again, the both general and local hyperemia are classified as acute and chronic. Acute general active hyperemia, chronic general active hyperemia. Same acute local active hyperemia, chronic local active hyperemia. Now, in case of congestion, that is nothing but the passive hyperemia. It is again classified as general and local. General affecting the whole body, and local is restricted to the regional part of the body, and it is again classified as acute and chronic. In such condition, we refer it as acute general congestion, chronic general congestion, and acute local congestion, chronic local congestion. And the one important point we should have keep in mind is that in case of hyperemia, that is nothing but the active hyperemia, the chronic accumulation of increased volume of blood is not seen in the active hyperemia. The active hyperemia is always a case of acute condition. It is not at all related with the chronicity of the condition. So this is the point we should have keep in our mind whenever we are studying the hyperemia. Now let us come to the one by one. The first one is active hyperemia. Active hyperemia, in which increased blood in the arterial side, usually due to inflammation. All active hyperemia are acute. In active hyperemia, we cannot see the chronic active hyperemia does not occur, and occurs when there is demand for oxygen and nutrients, that is to increase metabolism. Whenever there is the need of increased metabolism, in such condition, the system wants more supply of oxygen and nutrient. The supply of oxygen and nutrients are meant through the blood itself. So in such condition, the body or the system modify itself to increase the blood flow to the organ or the system where it necessary, and so it is usually a beneficial condition. Active hyperemia is a beneficial condition. This is the one point we should have keep in our mind. And the second one is it is not usually occur in chronic cases, and it is always been active acute case, and these are the 2 points we have to be keep. And the next type of acute hyperemia is acute general active hyperemia. Now, the word general means that the hyperemia is present within the whole body. Now, there is increased blood throughout the body. That may be because of the various systemic diseases like vasculosis and erysipelas. Erysipelas is caused by erysipelosis rhizopathy. In such diseases, there is rapidly beating of heart will be there, that leading to the increased blood supply to the organ or the whole body, leading to the accumulation or the increased volume of blood in the system of the whole body. That is called as acute general active hyperemia, and it may be because of the damage of the kidney renal diseases that will lead to the retention of the fluids. Now, microscopically, the affected part shows bright red color of the organs. This is because the blood which is present in the arteries is oxygenated blood. So the organ is having the increased blood volume in the affected organ or the part of the organ. So it looks like bright red color macroscopically, and microscopically arteries and capillaries are dilated with the blood. Yes, because whenever there is a more inflow of the blood in the arteries and capillary, so the increased volume of blood will dilate the capillaries and arteries. So microscopically we can notice the dilated arteries and capillaries, and the result of these hyperemia is leading to be it should not damage any, it should not cause any serious condition. If the cause is removed, then the hyperemia condition can be removed or it will disappear. Now let us come to the next one, that is local active hyperemia. Acute local active hyperemia. In this condition, there is increased amount of blood in the arterial system within a local area. For example, in case it may be in the legs, and the hyperemia is restricted to the stomach and it is restricted to the lungs. In such condition, we refer it as local active hyperemia, and it is the most commonest type of hyperemia. Acute local active hyperemia. Local case is the most commonest type of the hyperemia. Now let us come to the causes. There is, the causes may be physiological or sometimes they may be due to acute inflammations. When it comes to the physiological causes, it occurs in the stomach and intestine following a meal. After the meal, then body is going to metabolize the taken meal, that leads requires the nutrients and the blood. The blood contains nutrients and oxygen supply to the organ to digest or metabolize the meal. In such condition, there is increased blood flow to the organ, and in case of lactating mammary gland to produce milk, there the requirement of the blood will increase physiologically, that is leading to the local active hyperemia. And muscles during the exercise, and the genital tract during the stress. These are the physiological causes that will lead to the local active hyperemia, and these all are beneficial. And whenever in case of any inflammations to the organs or the part of the organs will be there, in such condition we can notice the acute local active hyperemia. Macroscopically, the affected organs are enlarged, swollen, and there is increased warmth in the skin because the blood flow will be increased, and that increased blood flow is in the arterial system, so the increased warmth will be seen in the skin. And in microscopically, in live animals, arteries, arterioles, capillaries are dilated with the blood, and it is difficult to detect in the dead animals. This is because in the dead animals the neuronal receptors will be deactivated, and in such condition the arteries are unable to push the blood to the required organ. In such condition we will be unable to distinguish whether it is hyperemia or congestion, and in such case it is very difficult to detect in the dead animals. This is about the topic active hyperemia. In next video we will be discussing the passive hyperemia or congestion. You might have surprised that we only discussed the acute conditions, acute general and acute local, because in case of active hyperemia, there is no chronicity factor is involved. This is the point we have to be remember while dealing with the acute hyperemia. This is about the today's topic. In next video, we will be discussing the congestion part. Until then, thank you. Keep going.